Now, this is the science behind the fact that fruits and vegetables are harmful. We used to say to us when we were growing up that an apple a day keeps the doctor away. It is in fact scientific fact. And an apple a day keeps the doctor away. So apples, like many other apples, provide essential vitamins and minerals, fiber, and other substances that are important for good health. They are naturally low in fat and calories and are filling. For that reason, if you're craving for candy or other junk food and you take an apple, because apple contains some sugar but less calories than junk food, you feel satisfied and the hunger abates, which is why it's encouraged that we eat fruits as many times as possible during the day. Fruits and vegetables lower blood pressure, reduce the risk of heart disease, stroke, and some prostate cancers. Including prostate, colon, and breast cancer. And that is from studies done by Harvard School of Public Health. They also lower the risk of eye and digestive problems. Apples protect the brain from neurodegenerative diseases such as Alzheimer's disease and Parkinsonism. And that's a study from scientists from Cornell University. Next slide. It's been proven that people who eat 5 apples or more a week have lower respiratory problems, including asthma. And the juice from apple contains antibacterial properties that prevents tooth decay, and so apples also keep the dentist away. Diets rich in fruit and vegetables, which have a high content of antioxidants, promote health and reduce the effects of aging. That is, they reduce the risk of chronic disease. Now, isn't that the reason why we also drink these so-called nutritional supplements? Because we want to prevent chronic disease. Now, have you heard that anybody develop chronic renal disease because he ate an apple or an orange? It doesn't happen. But these so-called nutritional supplements have a lot of adverse effects that are deleterious to health as well. We'll come to it later on. Now, so how is food harmful? I will illustrate that for you by using 3 examples: junk food, trans fat, and supplements. Next slide. I already told you what junk food is. Processed food. Junk food is made on processed food, and processed food is made largely by refining. Refining simply means that you remove the brown husk that covers the wheat grain or rice grain, and then you have that white grain that is all starch, right? Now, this white grain is then ground into a powder. It is decolorized, so it appears white, like white flour or white rice. Now, that process of removing the husk and bleaching it, you also remove all the essential vitamins and minerals from wheat and from rice. So all you have is plain white sugar. Now, without the white husk as well, when you eat white rice or eat white flour, the sugar from the starch contained in the wheat or rice rises quickly through your blood. So you have what doctors call hyperglycemia. And these foods are said to be high glycemic index foods. Now, because you have very high levels of glucose in your blood, the body reacts by releasing insulin in very high amounts to contain high sugar. So you have what doctors call hyperinsulinemia. Unfortunately, the combination of hyperglycemia and hyperinsulinemia also predisposes you to obesity and high blood pressure. Right. So, eating meat pies, donuts, sausages, and other prepared with hydrogenated oils, we'll come to that in a minute, and white flour, are those very high calorie. All they give you is high energy, nothing else. They do not contain minerals, they do not contain any vitamins, right? With the result that you become fat, you have more cholesterol, you have more salt, and fewer vitamins and minerals than fresh food. Besides, these high glucose excursions, the rapid rise in glucose in your blood, acts like, if you like, taking heroin or cocaine. It gives you a high, which drives you to seek these foods occasionally. In other words, you develop a compulsive habit to seek sugar, to give you this high that is derived from that. So you can become addicted to this junk food as well. Next slide. Trans fats are the oils that are used to prepare junk food usually contain trans fat because they are cheap vegetable oils anyway. Now, trans fat occurs because people found that with time, if you leave vegetable oils in one place, they become oxidized and they become rancid. In other words, they taste sour. To prevent that process from happening, they put hydrogen through vegetable oil. So they became hydrogenated vegetable oils. Unfortunately, passing hydrogen through vegetable oils also converted the cis fatty acids to trans fatty acids. So it's like writing C forward like that, and when you pass hydrogen, it becomes C backwards. It's the same fatty acid, except that the configuration is now different. Now, this chemical transformation of fatty acids makes the same fatty acids unrecognizable to the human body. So it treats it like saturated fat. The body can't digest it. So it accumulates in your arteries, accumulates in your blood vessels, accumulates in your brain, and causes all kinds of problems for human beings. Next slide. This is what happens when you eat junk food. I just give an example of this huge hamburger, right? Now, you eat junk food persistently, and the result inevitably is that you become obese, you become fat. Being fat has all kinds of problems. But let's just look at these three problems. It reduces mechanical stress that leads to sleep apnea. You stop breathing at night, depending on how fat you become, because your chest wall is too heavy, so that expiration now becomes a huge effort. It develops osteoarthritis from the sheer weight your knee joints have to bear because of the excess weight. You develop low back pain, and then you develop shortness of breath, or what doctors call dyspnea. Now, obesity also causes an increased level of free fatty acid in circulation. And what happens is that because you have an excess amount of free fatty acids, these free fatty acids become oxidized by your liver and by your skeletal muscles at the expense of sugar. So in other words, the sugar that even just accumulates in your blood gives rise to high levels of insulin, and then eventually the body no longer responds to the insulin, and then you have type 2 diabetes, and then you have hypertension, as I mentioned earlier, and abnormal levels of lipid in circulation. These three factors give rise to type 2 diabetes and to cardiovascular disease, which is stroke or myocardial infarction, or heart attack. Now, obesity also gives rise to levels. In women in particular, there is an increased level of estrogen, which now gives you breast cancer, one of the hormone-dependent tumors. Next slide. Supplements. Supplements arose because it was discovered a while ago that patients or people who eat fruits and vegetables have a lower incidence of cardiovascular disease. And so people now say, okay, what is it in fruits and vegetables that promotes this effect? And they found that it contains a lot of vitamin C, a lot of beta-carotene, etc., which are essentially antioxidants. Now, most supplements in circulation today are marketed because they are antioxidants. The problem is that before a drug is put in the market by a pharmaceutical company, it undergoes a series of tests that cost billions of dollars to be sure that it is both effective and safe. These supplements do not undergo the same rigorous screening process. It's from natural sources, and that gives you a number, and you begin selling what they call, for instance, blood purifier. It purifies nobody's blood. Instead, you end up with chronic renal disease, kidney failure, you end up with high blood pressure, you end up with liver damage. I'll give you examples. In our university of Port Harcourt, we did studies with aloe vera, and found that aloe vera, in the doses recommended by the manufacturers, Forever Living Products and GNLD, in laboratory animals, cause kidney disease, cause liver toxicity, in the doses recommended by manufacturers. But we found that if you multiply the doses that are recommended, then it became safe. The livers are safe from this toxicity. The trouble is that these drugs, you don't know who will respond in whatever manner to these drugs. So they are not safe drugs to take. We did the same thing with protein powder and found that all the animals who gave this protein powder, they all developed chronic renal disease. So supplements are potentially harmful. Besides, as I mentioned before, if you can derive the same benefits from supplements as you can from eating fruits and vegetables, why take the supplements? Next slide. Now, so this is the healthy eating plate as proposed by the Harvard Medical School, Harvard School of Public Health. Let me begin with the things that are outside the plate. So what we drink, for instance. We're encouraged to drink as much water as possible. Water has no calories whatsoever. So you can drink as much as you can tolerate. You're also encouraged to drink coffee or tea because coffee and tea also contain these useful antioxidants that we're talking about, but with little or no sugar and very little cream. That's milk. You're advised to avoid sugary drinks in whatever form, whether it's called low sugar malt or high sugar malt or Fanta or Coke or whatever. They are really not helpful to anyone. And then you are also advised to use healthy oils to do your cooking. So what are healthy oils? Healthy oils, by my experience, is either olive oil or canola oil. I'm sure some people say soy oil is being, I'm telling you from my experience, these are oils that have been involved in studies for so many years and proven to be heart healthy. So, you can use olive oil or canola oil for cooking and for your salads and avoid trans fat. If you didn't do before, when you go to the shop to buy a vegetable, please look on the can because they are mandated to list the chemical components in their oils. If you see trans fat, whether it's 1% or 0.1%, just run away from those oils because they are not good for you. That is the truth. You should not buy any oil or use any oil that are from that contain trans fat. Now, these oils that contain trans fat are usually the cheapest oils as well. So you have, is it turkey they call it now? Yeah. They're cheaper, far cheaper than olive oil or canola oil. And that is why many people use them in fast food restaurants. They have to make their profit. And anything that is fried or cooked with these cheap oils is not healthy for anybody. Alright, so let's go to the plate itself now. You can see half of the plate consists of vegetables and fruits. And these vegetables don't have to be celery or broccoli or cauliflower, all those fanciful names. They can be vegetables that are derived from our own farms here. And then fruits. The fruits don't have to be imported ones as well, although apples have been studied extensively. And they are available everywhere now, so you can eat apples as well. So half of your plate for every meal should consist of vegetables and fruits. Then the other half should consist of whole grains, if it's possible, right? Or healthy protein, that is protein from fish, from poultry, from beans, from nuts, and limit red meat. Avoid processed meat, corned beef, bacon, and whatever. Those ones are not helpful to you. And then, to remain healthy, you must stay active. You must exercise. Exercise doesn't mean that you have to go to the gym and press iron. It means that you can take a walk every other day. Some people have said that if you exercise for 120 minutes a week, that is sufficient. 120 minutes is just 2 hours. That's 30 minutes of exercise 4 times in a week. Or the alternative is to take 10,000 steps a day. You don't have to walk outside. 10,000 steps a day is like walking for about 45 minutes to an hour. And they have means of measuring it. Most phones these days have pedometers that you can download that can monitor how many steps you take in a day. The reason for monitoring how many steps you take is that when you're conscious of it, then when you don't need to drive, you walk. When you are in your office idle, you can stand up and walk on the spot just to complete the number of steps that you need to take in a day and to remain healthy. Next slide, please. Now, so I've told you what is healthy to eat. The next question is, how much should you eat? Because even if you eat only vegetables or eat only fruits, you can get fat if you eat too much. So, how do you know how much you eat? Because how much you eat is as important as what you eat. Now, you can decide how much to eat by calculating how many calories are in the food you eat. So if you decide to eat one meat pie, how many calories are there in one meat pie? I'm not sure I know the answer to the question. I'm not sure anybody here knows either. But it's important to know these things. But it's going to be difficult to calculate the calories. Eat foods for which you can know and determine the amount of calories. It's always better to eat foods that contain a lot of fiber because then you can eat much more if you want to and escape getting fat. How much you eat also depends on your age, your sex, your height, whether or not you intend to gain weight or lose weight, and what medications you may be on. So for instance, there are some people here who need to gain weight. They must necessarily eat more. Right. Now, it is also very importantly based on your basal metabolic rate. That is how much energy you burn at rest. When you're not doing anything, how much energy do you burn? There are ways of calculating this basal metabolic rate. Next slide, please. So this is how to calculate the basal metabolic rate for both men and women. But if you don't like mathematics, you don't need to bother. Not many people do this. I don't do it either. I've calculated my basal metabolic rate just for illustration. If you eat food and you're getting fat, nobody will tell you. Your skirts become tighter, your shirts become smaller around the neck, and so on. So you can just adjust. But there are also what are described as portions on the internet that you can download. So what is an ideal portion of rice? Is it 1 cup of rice? Right? There are estimates as to how much calories are there. You can look them up on the internet. Alright. Next slide, please. The next thing to do is to determine how much physical activity you undertake during the day. So for instance, you do light exercise, no exercise, moderate exercise, and very heavy exercise. Now there are factors that you can use to multiply your basal metabolic rate to determine your calorie needs for one day. Alright, next slide. So for me, my calorie load requirement is 2,818.89 kilocalories to maintain my current weight. So if I decide that I want to lose weight, I'm too fast at this, then I need to cut down the amount of calories I can take per day. Right? Or I can also decide to increase my physical activity level. Or I can do both. In fact, it's usually easier to do both. Because if you decide to just lower the amount of calories you take, so for instance, somebody has a requirement of 2,500 calories and decides to lower it to 2,000, it will take him 7 days to lose 453.59 grams. That's less than half a kg in 7 days, which is why dieting to lose weight can be very frustrating. You must eat right and you must exercise if you want to lose weight significantly. I won't bother you with the details of how to calculate this one. Go on, next slide please. So, for more reading, I gave another lecture on this subject at the University of Port Harcourt in August. You can access the file on at that address. And then you can also go to the Centers for Disease Control website, which has a lot of detail that will benefit you. Next slide. Thank you very much for your attention.
Thank you very much, Dr. Yobu Seminialai. A big round of applause once more.